As the lead for the Admission Avoidance Service, I'm responsible for the overall management of the service. It's a large service made up of 4 teams. We've got the Community Matron team, the Rapid Intervention team, previously known as Rapid Response. We've got the Hospital at Home team and the Community Intermediate Care team. The service has a mix of skills within it. We've got advanced nurse practitioners that are independent non-medical prescribers. We've got specialist nurses, community matrons that are also non-medical prescribers, physiotherapists, occupational therapists and clinical support workers. We have an acute hospital consultant who supports us medically in the community with some of our patients. The team work together to provide a variety of pathways for patients to support patients to stay at home and prevent hospitalisation. We work very closely with our acute, community and social work colleagues, so when we do have to admit patients to hospital, we can provide an early supported discharge back home into the community. I'm really passionate about our service and incredibly proud of our achievements. We've developed new teams, we've integrated our existing teams to create a stronger admission avoidance service, which has provided more opportunities for patients to be cared for at home. We're constantly working to improve and expand the possibilities further. Working as a healthcare professional in the community can be extremely challenging, and particularly when managing patients who are acutely unwell. But this is particularly rewarding when you know you're enabling a patient to be cared for at home with the support of their loved ones. Working as a healthcare professional in the community is extremely challenging. It requires a great deal of autonomy, but it can be extremely rewarding when you can see patients that you've cared for and you see them remain in their own homes with the support of their loved ones at a vulnerable time. There's a great vibe within the service. There's a fantastic team of skilled, dedicated staff who go above and beyond every day for our patients.
I work for the Hospital at Home team. We're a community team that prevent hospital admission and facilitate early discharge. We administer a wide range of IV antibiotics, intravenous antibiotics in the community for a wide range of conditions, and we also monitor patients with COPD and also DVTs. There's 11 of us on the team altogether. I've worked for them for 16 years, so obviously I find it very enjoyable and rewarding. It is just very rewarding visiting patients in their own home and administering antibiotics in their own environment. I mean, at the end of the day, if given a choice, most people would rather achieve the treatment at home than in hospital. And the bonus is also that we free up hospital beds, which obviously helps the trust.
I'm an occupational therapist for the Community Intermediate Care team and Rapid Response Service. And we see patients to either help to avoid hospital admission or to facilitate an early discharge for them. We see patients for a maximum of 6 weeks. The interventions that we provide are very much around helping somebody to regain their independence, looking at safety concerns and addressing their own goals. We have occupational therapists, physiotherapists, nurses and rehabilitation assistants in the team, and we aim to provide quite intensive support initially that reduces over the period of time that we're going to see people. In rapid intervention, we as a therapy team respond very rapidly to referrals and predominantly addressing manual handling concerns and any other issues that require immediate intervention. And we look at fast track access to equipment and to training for family members, that kind of thing. We also within the team have the early supported discharge service for stroke patients to enable stroke patients to come home earlier and to receive some specialist stroke-based interventions. And within that team, as well as occupational therapy, physiotherapy, We have speech and language therapy and a dedicated team of specially trained rehabilitation assistants who've done stroke competencies.
The community matron service are a team of specialised nurses within Wolverhampton who look after patients who have long-term chronic complex conditions. And we actually visit the patient's home and we use a case management model to assess the referral into the service. We help patients who are actually still acutely ill on discharge from hospital, and we also help patients who have had a lot of hospital admissions to actually understand what their long-term condition is and how that they can themselves manage that condition safely and appropriately within the home environment. The community matron service actually is a service that can really deliver true holistic care. You actually look at the patients within their own home environment and actually look at the other issues that could have an impact on their health and well-being. You really get to know the actual families, the carers who are involved with the patients, and draw on what they need to do to help them remain in their own home. What we do, we actually become a coordinator of the patient's care, where we actually, following our initial assessments, we actually look at what the issues are and actually communicate and collaborate with other healthcare professionals if we feel that their services can enhance the care.
And so my husband went to the surgery and he said to the receptionist, you know, is it possible to have one of those rapid response nurses? My wife is so poorly and she can't come here. And she made a phone call straight away and he came back home and Emma was here within less than an hour. I mean, when the doorbell went, I thought, I don't believe, you know, I heard the doorbell, I don't believe she's here. And she came in out and she was so lovely. She had such a lovely, sunny personality and she was efficient. Anyway, she arranged for a hospital at home nurse to come from West Park Hospital. She came the following day. Then they referred me to the community matrons and their service is absolutely fantastic too.
I'm one of the advanced nurse practitioners working for the rapid intervention teams. Our aim is to reduce hospital admissions. Patients within the Wolverhampton area are referred to us, get seen within 2 hours of referral. Conditions that are referred to us are conditions that would be, if left untreated, would lead to a hospital admission. Such conditions are exacerbation of chronic lung conditions, chest infections, urine infections, wound infections, cellulitis and falls without apparent injury. We see patients within their own homes as well as within nursing and residential homes. We also see patients with sheltered, supportive and independent living within the Wolverhampton area. These patients are usually unable to get to their GP or to the walk-in centre and usually call an ambulance or get admitted to hospital if they're not seen, diagnosed and treated for their condition. I'm extremely proud to be a senior member of this team, which I've been fortunate to be involved in from its infancy 18 months ago to a very successful service that it has evolved into.
Managing a care home demands collaborative working from all professionals who are involved in caring for the vulnerable service users who we care for. Collaborative working is essential to maintain high standards of practice and high standards of care. We are fortunate at Parkfield Nursing Home to be working with Wolverhampton Clinical Commissioning Group, RITS team. The team work with us to ensure that at any time we need any support or any additional clinical input, there is always someone there who we can phone 24 hours a day, 7 days a week. We have formed a good relationship with our RITS team nurses, and they are available whenever we call to give us the extra nursing care and valued professionalism that we require to ensure that all the care needs for our service users are met. We take advice from their clinical expertise, and we use that advice to support the well-being of all our service users. Every member of the team is respected, and they give us the respect we expect also. This team is also supported by the input that we're afforded each week from our local resident GP. The value of the members of the RITS team is especially notifiable outside of working hours. The RITS team have now increased their hours to give us the support we require during bank holidays and Christmas days, as this is usually the time when service users continue to be unwell.
It helps me to feel a little bit more confident about myself, because I don't feel quite so much on my own. Because I think if you have a condition, you sometimes feel a little bit on your own, because especially if you don't know anyone else who's got it. And so I've just found everything so good. And I've told everyone about it. And I really have. And I can't say enough. It's just absolutely brilliant.